Alright, this video is about calcium. Normal lab values are between 9 and 10.5 milligrams per deciliter. It gets redistributed between bones and extracellular fluid. It moves in and out of cells via a calcium pump. The parathyroid hormone and calcitriol increase serum levels. Calcitonin decreases. It tones it down. Functions: gives firmness and rigidity to bone and teeth. It activates enzymes to stimulate chemical reactions for hormone secretion. Transmits nerve impulses. Regulates skeletal and heart muscle relaxation, activation, excitation, and contractions. Maintains cardiac pacemaker. Blood clotting. It activates conversion of prothrombin to thrombin. It exerts calming effects on nerve cells, and it assists in acid-base regulation. Hypercalcemia risk factors. Hypercalcemia is too much calcium. Hyperparathyroidism is a risk. These are risk factors. Hyperthyroidism, metastatic cancer, vitamin D or calcium overdose, prolonged immobilization, renal failure, thiazide diuretics, hypophosphatemia, and steroid therapy. Some manifestations of hypercalcemia include, for cardiovasculars, hypertension, decreased ST segments, shortened QT interval, dysrhythmias such as heart block and cardiac arrest. For GI, there's hypotonic bowel sounds, constipation, anorexia, nausea and vomiting, and abdominal pain. For renal, there is polyuria, which is associated electrolyte imbalance, polydipsia, and decreased ability to concentrate urine. For neuromuscular, there's depressed neuromuscular excitability, decreased DTRs, memory impairment, personality changes, bizarre behavior or psychosis, lethargy, headache, confusion, fatigue, and coma. For musculoskeletal, there is pathologic bone fractures, bone thinning, bone pain, and impaired mobility. For treating this, to promote excretion, you want to use loop diuretics. Hydrate with IV fluids to promote excretion or oral fluids. Calcitonin tones it down. Weight-bearing activity, partial parathyroidectomy, stop taking vitamin D and supplements, eliminate antacids, IVF normal saline solution. If cause is primary hyperparathyroidism, only chronic management is a parathyroidectomy. For monitoring things, you're going to monitor the calcium and phosphorus levels, BUN and creatinine, daily weights in response to therapy, I's and O's, ECG, X-rays for bone changes and fractures, urine for renal caliculi, and then for heart failure during fluid challenge. Next we have hypocalcemia, which is not enough calcium. Decreased parathyroid hormone, usually second degree to hypoparathyroidism. Hypomagnesemia Hypomagnesemia. When low, the parathyroid hormone is impaired, lowering serum calcium. This also lowers the threshold for tetany. Alkalosis. More calcium binds to albumin. Lactose intolerance. Renal failure because the kidneys cannot produce the activated vitamin D or calcitriol. Increased phosphorus such as diuretics. Some medications, low albumin, and alcoholism due to the low albumin and low magnesium. Some signs and symptoms of hypocalcemia are tetany, positive Trousseau's sign, positive Chvostek's sign, numbness, tingling around the mouth and extremities and in fingers. Can have cardiac symptoms, bradycardia, hypotension from weak heart contractions, and muscle cramps. So treating this includes oral and IV calcium supplements, high calcium diets, vitamin D supplements. Watch those who have had thyroid or neck surgery. It may accidentally remove or damage the parathyroid gland.